Okay, so are you ready to dive into this?
I am. Bring it on.
All right, let's do it. Today we're tackling the VA's Electronic Health Record Modernization Program.
EHRM.
Yes, EHRM. It's a pretty massive project, right?
Yeah.
Trying to replace their entire system with a new one from Oracle. And we've got a lot to sift through here. Congressional hearings, witness testimonies, government reports, even a YouTube video with,
Wow.
yeah, quite a stack.
Spicy.
It is spicy. So much information. So the big question that keeps popping up is, will this actually work? I mean, will it actually make things better for veterans and for healthcare providers? Or is this going to be like another expensive tech flop?
Well, that is the question, isn't it?
It is.
It seems like every few years there's a new attempt to, fix the VA's EHR system.
Right.
And it makes you wonder, is this time going to be any different?
Yeah, because this isn't their first rodeo.
No, it's not. This is actually their fourth attempt to try and get this right.
Fourth attempt.
Yeah. The current program that we're looking at kicked off back in 2017. They signed a contract with Cerner. And then, of course, Oracle acquired Cerner in 2022.
Mm-hmm. Mm. And from what I've been reading, it hasn't exactly been smooth sailing.
No, it has not.
There have been outages, patient safety concerns, costs are out of control.
Yeah, it's been a bumpy road for sure. There's been so many issues that they actually had to hit pause on the whole thing back in 2023.
Really?
Yeah, they put the program on reset to try and figure out, what's working, what's not.
Okay, so like a timeout.
Yeah, exactly. A timeout to regroup and figure out how to move forward.
So where are we at now?
Well, the plan is to start things back up in 2026.
Okay.
They're planning to resume deployments at 4 VA medical centers in Michigan.
Mm.
But, the big question that's hanging over all of this is, are they really ready this time?
Yeah. Are they actually ready to go?
We've got a lot of different voices chiming in on this whole situation.
Right.
You've got the VA and Oracle saying, things are on track, everything's looking up. And then on the other side, you've got the Government Accountability Office.
The GAO.
Yeah. And the VA's Office of Inspector General, they're the ones sort of waving the red flags.
Really?
Yeah, and even Congress seems a little bit skeptical, they're not totally convinced that the VA has actually fixed the underlying problem.
That was like a tug of war.
A little bit, yeah. You've got these opposing forces with very different perspectives on how things are going.
Okay, so let's break this down a little bit.
Oh.
On one side, we've got the VA and Oracle,
Mm-hmm.
and they seem to be pretty optimistic.
Yeah, they're painting a picture of progress.
Well,
Talking about improvements to the system, better training, and even mentioning things like AI integration.
AI, that's a whole other can of worms.
It is. We'll get to that.
But it sounds promising on the surface, right?
It does, but then you've got the GAO and the OIG, and they're not so convinced.
What are their main concerns?
Well, one of the biggest things is the budget. I mean, we're talking billions of dollars.
Billions with a B?
Yes, billions with a B that have already been poured into this program. And it's only been rolled out at a handful of sites. So the GAO is saying, hold on a second, we need a realistic cost estimate here. What's this actually going to cost in the long run?
Right, because you don't want to run out of money before you even finish the project.
Exactly. And then you've got the OIG. They're worried about things like patient safety issues and the fact that there isn't a reliable master schedule.
So basically they're saying the VA needs to get their act together.
Pretty much. They're saying you need more transparency, more accountability.
So it's a lot of he said, she said.
It can feel that way, right?
So is there anything in all this information that helps us see through the fog, a little bit of clarity?
Well, there was that whole unknown queue incident that made headlines a while back.
Oh, yeah. I vaguely remember that. Remind me what happened.
Basically, it was this huge backlog of patient scheduling tasks.
Okay.
And they were all entered into the system incorrectly. Nobody was monitoring this queue, so these tasks just kept piling up and piling up.
Wow.
Yeah, it caused a ton of delays and confusion.
So was that a tech issue or a human error issue?
It seems like it was more of a human error situation.
Really?
Yeah, it really highlights how important it is to have proper training
Right.
and clear communication when you're rolling out a system this big and complex.
So it makes you wonder, are these just like little hiccups or are they symptoms of bigger problems within the VA?
That's a great question, and it's something we'll definitely want to keep in mind as we dig deeper.
Definitely.
Yeah.
So another thing that's supposed to be a big part of this new system is interoperability.
Right.
Making sure that a veteran's medical records are accessible no matter where they go for treatment.
Exactly. So, if they go to a VA facility or a DoD facility or even a community care provider, everyone has access to the same information.
So it's all connected.
Yeah, in theory it should be. But in reality, there are some pretty big hurdles to overcome.
Like what?
Well, a lot of it comes down to integrating this new system with the VA's legacy system, Vista.
Right, because they've been using Vista for decades.
Exactly, and it's not always easy to make these older systems talk to the newer ones.
So it sounds like we've got communication breakdowns, cost concerns, interoperability challenges. Are there any bright spots in all of this?
There are, actually. The new EHR does have some cool features that Vista doesn't have.
Oh, really?
One example is the built-in opioid advisor tool.
Oh, wow.
Yeah, it's designed to help clinicians when they're prescribing opioids.
That's huge considering the opioid epidemic and how it's impacting veterans.
Exactly. And then there's also a better way to track patient behavioral health flags.
Okay.
So this can alert providers to potential risks like, suicide or other mental health concerns.
That's really important, especially considering the higher rates of mental health challenges among veterans.
Right. So there are some definite positives. But then on the flip side, we also have to consider things like the staff cuts and hiring freezes at the VA.
Right, because that's been in the news a lot lately. How is that impacting all of this?
Well, it's definitely not helping. The EHRM integration office has lost a number of staff members.
Really?
Yeah, due to workforce reductions, and also some people have just, resigned.
Oh, wow. So they're losing expertise and manpower.
Exactly.
Yeah.
And that can make it even harder to manage this already complex program.
It's a lot to juggle.
It is. So, it's kind of a mixed bag right now. We've got some good intentions, some promising features, but the execution is definitely questionable.
Yeah, it sounds like a lot of uncertainty.
There is. And I think the VA and Oracle really need to address these concerns that are being raised by the GAO and the OIG and Congress.
They need to prove that they've learned from their mistakes.
Right. And most importantly, they need to show that they're putting the needs of veterans first.
Because at the end of the day, this is about the veterans.
It is. They're the ones who are going to be using the system.
Right. So if you're a veteran listening to this, you have a huge stake in this program's success.
Absolutely, because this is about your health records and your health care.
This is your life we're talking about.
Exactly. So the big takeaway here is that this program is still a work in progress.
Still evolving.
Yeah, and there's a lot that could still change between now and 2026.
So we're not out of the woods yet.
Not by a long shot. And there's one more piece of this puzzle that we need to examine.
Which is
artificial intelligence.
AI.
Yeah, remember how Seema Verma was talking about AI being a game changer?
Yeah, she made it sound like AI was the solution to everything.
She did.
Yeah.
But the details were a little vague. So in the next part of our deep dive, we need to really explore what Oracle's vision for an AI-powered EHR looks like.
Okay.
And we need to examine both the potential benefits and the risks.
So we're stepping into the world of artificial intelligence.
We are.
Let's take a quick break to process everything we've learned so far, and then we'll jump right into that fascinating and maybe a little bit scary world of AI.
Sounds good.
Okay, so we've laid out like the overview, right?
Yeah.
But now I want to get into like the nitty-gritty.
Yeah, let's dig into the details.
I'm really interested in seeing how the arguments from the VA and Oracle stack up against, those more cautious perspectives from like the GAO and the OIG.
It's like we're deciphering a message with like conflicting signals.
Right.
So let's start with Dr. Evans.
From the VA.
Yeah, his testimony. He really focused on those improvements that happened during that reset period.
Okay.
Talking about increased system stability, fewer outages, that sort of thing.
Right.
And he also emphasized how they've been working to establish this national baseline for standardizing healthcare delivery.
Oh, that makes sense. So like consistent processes across all the VA facilities.
Exactly. So it should theoretically mean, smoother transitions for veterans if they're moving between different VA facilities.
Right, because you don't want to have to like start from scratch every time you go to a new place.
Exactly. And he also pointed to some positive trends in user satisfaction.
Okay, but didn't the GAO have something to say about those surveys?
They did. Carol Harris brought up the point that the user base for those surveys was pretty limited.
Oh, really?
Yeah, it was only from those first 5 sites where there were a lot of early issues. So she was saying, it might not be totally representative of how all VA healthcare providers are feeling.
That's a good point.
But to be fair, Dr. Evans did acknowledge that, this is a complex change and they need to be vigilant and committed to excellence as they move forward.
So kind of like cautious optimism.
Yeah, I think that's a good way to put it.
Okay, so what about Oracle? What's their take on all of this?
Well, Seema Verma from Oracle, she really emphasized all the technological advances they've brought to the table.
Okay.
She's making it very clear that Oracle is not Cerner.
Right.
This is a fresh start. And she argues that using a commercial off-the-shelf product gives the VA access to all the latest technology and updates.
Which is something that they struggled with in the past.
Exactly.
Okay.
Mm.
But did she address those concerns about the pharmacy module?
She did. She acknowledged the initial issues
Okay.
and how the VA's pharmacy operations are so much more complex than like a typical commercial system.
Mm.
But then she went on to detail all these enhancements and safety features they've added to try and meet the VA's specific needs.
So are these changes actually addressing the core issues, or are they just putting Band-Aids on a bigger problem?
Well, that's the question, isn't it? And both Carol Harris and David Case, they're still pushing for that updated cost estimate and a comprehensive operational assessment. Like, they're saying, show us the numbers.
Right. Prove to us that this is actually going to work.
Exactly. And they're not just making vague criticisms, they're giving specific examples of where the program has fallen short.
Okay. Like what?
Well, David Case highlighted issues with things like appointment reminders
Oh, wow.
and medication management. And he's saying that these problems have actually increased the workload for VA staff.
Really?
Yeah, and they could potentially put patient safety at risk.
So it's like one step forward, two steps back.
Sometimes it feels that way.
And it's not just the GAO and the OIG, right?
Yeah.
Remember that YouTube video we watched from that subcommittee hearing? Several members of Congress were echoing those same concerns.
They were, especially the ranking member. He was really worried about the impact of those staff cuts at the VA
Right.
and how that's going to affect the EHRM program. Like, you need people to make this thing work.
It's like trying to build a house with like half a crew.
Exactly. And both Carol Harris and David Case brought that up in their testimonies, too.
They did.
They're saying that if you don't address those staffing issues, you're setting the program up for failure.
Okay, so we've got all these different viewpoints. We've got valid concerns from multiple parties and this like looming sense of uncertainty. What can we actually take away from all of this?
I think it's about taking a step back and really thinking critically about all of this information.
Okay.
You know, what's the motivation behind each statement? What information might be missing? Are there any biases that we need to be aware of?
Right, because everyone has their own agenda.
Exactly.
Yeah.
So we have to be careful not to just take everything at face value.
Just like we're trying to solve a puzzle. But some of the pieces are missing, and some of them don't quite fit.
That's a great analogy.
But we're going to figure it out. So what are the most important things we need to be considering here?
Well, first and foremost, the VA and Oracle need to actually address those concerns that are being raised by the GAO and the OIG and Congress.
Right. They can't just ignore them.
Exactly. They need to provide that updated cost estimate, they need to develop a comprehensive operational assessment, and they need to create a reliable master schedule.
They need to show us the receipts.
Exactly. They need to prove that they have a solid plan for the future.
Because actions speak louder than words.
Absolutely. And then second, patient safety needs to be the top priority.
Of course.
We can't be putting veterans at risk.
Right.
Those testimonies from David Case and Carol Harris, they highlighted some serious areas where the system has fallen short. And those need to be addressed, like, urgently.
And not just addressed like they need to be fixed.
Exactly. They need to show that they've actually learned from their mistakes and they're committed to doing things the right way.
Okay, so accountability is key.
It is. And transparency, too. They need to be open and honest about what's going on.
Right, keeping everyone in the loop.
Exactly. Both Congress and the public.
Because that builds trust.
It does. And then finally, they need to make sure that this program has enough staff and resources.
Because those workforce reductions are a huge red flag.
They are. It's like trying to run a marathon with a sprained ankle.
You're not going to get very far.
No, you're not. So to sum it all up, the future of this program really hinges on addressing cost transparency, patient safety communication, and adequate staffing.
It's a lot to tackle.
It is. But ultimately, the true measure of success is going to be the impact on the lives of veterans.
Right, because that's what this is all about.
Exactly.
Okay, so we've covered a lot of ground here.
We have.
But there's one more element that we need to address.
And that is
Artificial intelligence.
AI, the big mystery.
Right? Remember how Seema Verma was talking about it being a game changer?
Yeah, she made it sound like AI was going to solve all their problems.
But she didn't really give us any specifics.
No, she didn't.
Yeah.
So in the final part of our deep dive, we need to really explore what Oracle's vision for an AI-powered EHR actually looks like.
Okay.
And we need to examine both the potential benefits and the risks.
Because AI is a powerful tool.
It is, and it can be used for good or for evil.
So we need to be careful.
We do. Let's take a moment to gather our thoughts, and then we'll dive into this intriguing and potentially very impactful world of AI.
Okay, so we've talked about the budget, the patient safety concerns, the staffing issues.
Right.
But now we have to talk about AI. It's like the elephant in the room.
Yeah, it's the big unknown.
It really is.
Yeah.
Because it's a topic that everyone's talking about.
Yeah.
But it feels like nobody really knows how it's all going to play out.
Yeah, AI is definitely changing the game in a lot of industries,
Mhm.
and healthcare is no exception.
But I have to say, I'm always a little skeptical when a new technology comes along and everyone starts saying it's going to revolutionize everything.
I get that. It's easy to get caught up in the hype
Right.
and overlook the potential downsides.
So let's try to be realistic here. How could AI actually make this EHR program better for veterans?
Well, one of the biggest potential benefits is automation.
Okay.
Imagine if AI could take over all those tedious administrative tasks.
Like what kind of tasks?
Things like scheduling appointments, managing medications, processing referrals, all that stuff that takes up so much time.
Right. Because right now it's the clinicians who are doing all of that.
Exactly. And it takes them away from actually spending time with their patients.
So AI could free up their time
Exactly.
so they can focus on providing care.
Exactly.
That sounds like a good thing.
It does. And it could also help to streamline those processes and reduce errors,
Mm-hmm.
which could lead to shorter wait times for veterans.
Okay. I'm starting to see the potential here.
And then there's the whole area of clinical decision support.
How could AI help with that?
Well, think about it. AI algorithms can analyze huge amounts of data,
Okay.
like patient records, medical literature, clinical guidelines, and they can identify patterns and insights that humans might miss.
So it's like having a second set of eyes.
Yeah, like a super-powered assistant working in the background.
Okay. And that could lead to...
Earlier diagnosis, more personalized treatment plans, and hopefully better outcomes for veterans.
So there are some definite upsides. But we have to talk about the risks too.
Of course, because AI is a powerful tool.
Mm-hmm.
And like any tool, it can be used for good or for bad.
So what are some of the things we need to be cautious about?
Well, one of the biggest concerns is bias.
Bias.
Yeah, AI algorithms, they learn from the data they're trained on.
Right.
So if that data reflects existing biases, those biases will be baked into the AI's output.
So if the data is flawed, the AI will be flawed.
Exactly. And that could lead to disparities in care.
Where certain groups of veterans might not get the same level of care.
Exactly. So we need to make sure that the data being used to train these algorithms is diverse and representative.
Okay, that makes sense.
What else? Data privacy is another huge concern.
Of course.
We're talking about sensitive medical information. So we need really strong safeguards in place to prevent data breaches.
Right, because the last thing we want is for veterans' information to be compromised.
Exactly. And then there's the issue of transparency and explainability.
What do you mean by that?
Well, AI algorithms can be really complex.
Okay.
And it's not always clear how they're reaching their conclusions.
So it's like a black box.
Yeah, and that can make it hard for healthcare providers and veterans to trust the system.
Right, because you need to understand why a certain decision was made.
Exactly. It's not enough for the AI to just say, you know, you should get this treatment or you have this condition.
You need to know the reasoning behind it.
Right. So there needs to be accountability.
Okay, so it sounds like AI has the potential to really transform healthcare.
It does.
But we need to be very careful about how we implement it.
We do. We need to be aware of the risks, and we need to put safeguards in place to protect veterans.
Because at the end of the day, this is about people's lives.
Exactly.
Well, this has been quite a deep dive.
It has. We've covered a lot of ground.
We've looked at the successes and the failures, the hopes and the fears, and it's clear that this EHRM program is a really complex undertaking.
It is.
There's a lot at stake.
There is.
And the decisions that are made in the coming months and years are going to have a big impact on the lives of veterans.
And their families.
Absolutely. So if you're listening to this, we encourage you to stay informed, ask questions, don't be afraid to speak up, because this is your healthcare system.
It is. And you have a right to make sure that it's working for you.
Exactly. All right, well, that's all the time we have for today's deep dive. Thanks for joining us.
It's been a pleasure.